Hey, Dr. Paul, how are you? You're in the hot seat, Dr. Paul.
It's warm. Chief, this is warm.
We'll give you a second to get settled, Dr. Paul. I think they've already turned the binder for you. Okay, we now have the hearing with the health department. We have Dr. Paul. Dr. Paul, you know, in prior years you would be asked a different question, and you know, we've been presented with the status quo recommended budget. Can you just tell us with the budget that's been recommended, how that impacts the operations of your respective area? And just for the viewing audience, if you can provide just a brief synopsis of the services that you provide, and the floor is yours.
Thank you, Madam Chair. Good afternoon, and good afternoon, members of the committee. Is this thing on? It is, all right. With me are Diane Harden, who's our finance manager, and Dr. Sami Ariola, who's the deputy director of the health department. The health department's mission is to protect, improve, and sustain health and well-being for all people in metropolitan Nashville. It's a big mission. It's a mission that's kind of like being a doctor or a care team for an entire community. And it's a mission that we can't really do alone. So let me talk for a minute about Nashville's health. Our county health ranking in the state of Tennessee has gone from 13th to 6th, which is good. And that's encouraging, but there are several areas that we still are concerned about. One of the biggest is that our health varies widely based on where you live. From one zip code to another, the life expectancy changes significantly, and we believe that everybody should have an equal and fair chance at a long and healthy life, no matter where they live. Second, things like our smoking rate are higher than our peer cities. Obesity, lack of physical activity are getting, well, they're leveling off. They're not getting worse, but they're not where they should be. These are all ingredients of a healthy workforce, and a healthy workforce is really essential for Nashville to continue to thrive. Third, after many years where early deaths were declining, we're starting to see earlier deaths and shorter lives. And so people have talked about this in the news, and one reason we know has to do with the increasing rates of drug overdose, and we are experiencing that here in Davidson County. So Nashville's very rich with health care, medical care. It's crucial that we have a medical safety net that works. That's a different department, but even with perfect health care, our health statistics are going to be a challenge. They're not going to improve that much if we actually get that perfect health care. Most of our health actually happens outside of a hospital or outside of the doctor's office. So there's a lot that we do, both as a department and with folks around town to try to improve health, improve conditions for people to live healthy lives. One way of sort of painting the vision is that we need to do health in all policies. That is, we need to weave opportunities to be healthy throughout our city, just the way we weave music into the identity of Music City. We're making some progress. We've just been recognized as a finalist by the Robert Wood Johnson Foundation in the Culture of Health Prize, which is a community award for work to improve conditions for health in our community. So what do we do as a department? We provide public health services, we enforce health regulations, and we work to be Nashville's health strategist, which means we lead and support collaborative efforts to improve health in Nashville. I want to comment on just a couple of successes from the last couple of years. Our dental program is all about kids, all about prevention. We're a leader in silver diamine fluoride, which is inexpensive, but it's cutting edge, and it stops decay in its tracks, and is doing great things to prevent surgeries and help control decay in kids. The new WIC dental program is beginning to help Nashville's youngest kids get an early start on good oral health and prevent those cavities that can be so disabling later. Our school nursing program, we were able to successfully implement the first of what we still hope is a 3-year expansion in school nurses. This year we know is not our year. It's like the Cubs or the Predators. But we're grateful to the Metro Council for the support that you garnered last year to increase our school nurses. And you know, the school district is under pressure to reduce chronic absenteeism. And that's essential for improved school outcomes. And nurses prevent chronic absenteeism. It's what they do. It's what they're proven to be effective at. And so just last year, even with the increment that we had, our nurses have been calling parents of absent kids, connecting with them, providing useful information, identifying what some of the problems are. And if the parents have that trust and they have that nurse on the line, they're more likely to get their kids back in the class. Metro Animal Care and Control, always an interest of us, always an interest of the Metro Council. We made great progress in the last few years. 4 years ago, our euthanasia rate was 76%. Now our euthanasia rate is averaging 12%. Lots of additional successes with that group. We're very proud of the hard work that they've done. Beyond direct services, in the health strategist role, there's things that you've heard of. Adverse childhood experiences is something that nonprofits, government agencies, even the foundations in Nashville are changing their practice to better address what's happened to our kids, the severe adverse childhood experiences that have such huge lifelong health impacts on them. We are actually leading and supporting a group called All Children Excel, or ACE Nashville, and it's a very broad coalition that's doing a lot of different things across a lot of organizations to prevent ACEs and to help foster healthy brains as our children grow. Community mental health systems. Mental health is something we need to pay a lot of attention to. We've been working with collaborators over the last 2 years, and we were able to, with Metro's support, thank you, Metro Council, but also with state support, expand services at the Mental Health Cooperative for crisis services. And this was all aimed at pre-arrest diversion, that is, families with somebody who's in crisis, or police who have somebody that they know is in a mental health crisis, making that a much more efficient handoff to somebody who can get them immediately into care and reduce the chances that people who really have mental illness end up in the jail. So this is pre-arrest. It is very complementary to the sheriff's project that we are working with him on, which is kind of post-arrest at the front door of the jail. And we're excited about the two of these as complementary approaches to reduce the number of people with mental health issues that are in jail. Infant mortality is a fundamental reflection of our community's health, and we've been leading and collaborating with others on this. Every baby needs to sleep on their back, in a crib, and alone. That's ABC, alone, on their back, and in a crib. And last year, working with the Nashville Infant Vitality Collaborative, we were able to mark a 30% decline in sleep-related deaths. Finally, the opioid epidemic is still a major issue for us, but not one that we have a lot of resources to put into. Last year, we might have seen some leveling off of overdose deaths overall, but 336 Nashvillians lost their life to drug overdose. 101 had heroin in their blood when they died, and that's up from only 2 in 2011. 105 had fentanyl. Both heroin and fentanyl are increasing rapidly. So our team has made improvements in real-time tracking of overdoses, looking for clusters and patterns. We've built our lines of communication both within first responders in Nashville, but beyond to the Nashville Prevention Partnership and others. We have worked with StreetWorks to become the first sanctioned syringe service program in the state. And we've also been working to expand access to drug take-back services. There's more to say. I can talk about public health all day, but I'm just really proud of the work that our men and women do every day to keep Nashville safe and healthy and to build a culture of health for Nashville. So thank you for your attention, and I'm happy to take any questions that you have.
Great job, Dr. Paul. Vice Chair Schulman.
Thank you, Madam Sharon. Thank you, Dr. Paul. A lot of good information there. Just 2 budgetary questions. One is you have, I think you have like 500 and some positions, let's say 551 positions. In terms of vacancies in any of those positions, do you have vacancies in any of those at this point?
We do have vacancies. More than half of our positions are grant funded and therefore not supported by local funds. And out of those positions, we have 13 local vacancies and 19 grant vacancies.
Okay, so when you say 19 grant vacancies, and what was the other number, 13?
13 on
13 vacancies based upon funding from Metro?
Correct.
Okay. And then the only other question I had was on animal control. It looks like, if I counted this right, you've got 36 positions at animal control. Does that sound right?
That sounds right.
Okay. And they were all at this, are they filled at this point, or do we know? I know that's more specific.
I don't have.
I think
You
we
can
have
answer.
One vacancy? Okay.
We are conducting.
Okay. All right. That's it. That's what I needed to know. Thank you.
Thank you, Vice Chair. Councilman Glover.
Thank you, Chair. Just very quickly, the nurses that the council approved, that we actually allocated the money for, that goes into Metro schools, that was not cut. That's not been affected. That still is in the budget for this coming year. So Metro schools will not lose any of those positions as far as the nursing, or nurses, will they?
Correct.
Okay.
The investment that the council really pushed for last year actually sent those funds to the health department's operating budget. So
Right
now the nurses are both in the school's operating budget and some new ones in the health operating budget, and those are being carried forward.
Okay. And that was the new ones, because we
Correct.
heard from parents. And so I just wanted to make sure that was, I mean, that was one of the reasons we kind of did it, was to make sure that that wasn't going to be cut, because from everything we heard, that was extremely important to have, and much more so than I probably understand, but I just want to make sure those were there. Thank you, Chair.
Thank you, Councilman Glover. Council Lady Karen Johnson.
Thank you, Department Head Paul, Doctor, I had to make sure I say that, and your incredible staff at the Health Department. Thank you all for everything you do in our community. It's good to know that one of our priorities really worked out and was appreciated with regard to the nurses and Metro schools. So as a council, we got that right?
Absolutely.
We as a council, we're doing good here.
We're very appreciative.
Thank you.
We optimal, or at least our plan, our deal plan, like when Metro's budgetary troubles all melt away, and the ability to fund priorities advances some more, is really it will expand beyond what we've got now. So this was one great step, and we propose to have 2 more great steps, and we know this isn't the year, but.
Well, I love to hear kudos when it comes to priorities, and our priorities are actually being accomplished with education and health and wellness of our children. And so I think us as a team, as a council, and you leading the health department, I think that is proven through that right there. So my question is, under the animal welfare, where you're adding $100,000 for the continued supporting of funding for animal welfare, is that grant funding, or what is that $100,000 going to do?
Yeah, so
is that adding to animal control?
Not exactly. But it is part of the, what I told you about the health department is we can't do it all ourselves. And so what this $100,000 it does is it started as a public investment plan, and it's sustained funding beyond the end of the public investment plan for this coalition called the SAFE Coalition. This SAFE Coalition is receiving a grant, and what they then do is fund subsidized spay-neuter in the community for families that really need spay-neuter but can't afford it. And so I think that's the major investment. Dr. Ariola, do you have anything to add to that?
So the goal for Nashville is 100 placement of healthy animals. And so what we did there is really let people know that it's not MAC responsibility alone, or the health department's responsibility. So the idea is to bring all the players and partners and stakeholders in Nashville together, and the key ones are sitting at the table and they're expanding. And so they're addressing the key goals, spay, neuter, and again, just to relieve the pressure on MAC and go towards the goal that Nashville wants to achieve.
Excellent. Thank you so much.
Thank you so much, Council Lady Johnson. Seeing no other council members seeking recognition, thank you so much, Dr. Paul, and the service that you and your staff provides for the city. And that concludes your hearing. If MTA can begin to make your way down.